I am Dr. Travis Wilkes. I am a medical doctor. I'm board certified in family medicine. Being a doctor is hard, especially today. You have your job of taking care of patients, and then you also have your job of electronic medical records and paperwork and trying to filter all these things out. It's really a hard thing. I think that one thing that this test does is it actually simplifies things the same way that a CT scan simplifies things. You can spend an incredible amount of time trying to dissect out history, trying to really understand things and try to look at basic labs and try to infer and extrapolate and interpret. But what if there was a tool like a CT scan that just said, this is the problem right here, and allowed you to sort of three-dimensionally look at something. And I think that's what Ixcela does. It adds another dimension that gives you a dynamic view of what's happening with the biochemistry in the body that doesn't necessarily need you to then interpret or extrapolate as much. You're able to say, I wonder what's happening in the dynamic interaction between this person's genes, their environment, their lifestyle, their stressors, their diet, medication. I want to understand that dynamic interaction. And I feel like the Ixcela test lets you kind of hold it up and rotate it a little bit and look at it and say, oh, now I can see what's happening. And this is what I need to focus on. And this is what I need to focus on. And it gives you clear targets where otherwise you're sort of left guessing. And I think in that guesswork, there's a lot of time, there's a lot of effort. And today we don't have as much time for that as we'd like. And so this allows a targeted approach to the real problems that then we can use to just, to create solutions. So the metabolites in the Ixcela test, at first glance to most physicians, come across as sort of foreign or used for things that they're not accustomed in thinking about outside of that window. Uric acid, for instance, we're very comfortable in thinking of uric acid for gout. We're not as comfortable of thinking about uric acid as a metabolic marker, but that has to change. And I mean, that's a good thing, is that because if anyone goes and dives into the literature, they'll find out that all of these markers have a very deep evidence-based nature, and they'll find uses for things like uric acid that they had no idea that they should have been thinking about. So while Ixcela is unique and novel, and maybe a little bit intimidating for some people when they first hear about what these markers are, if you take the time to really understand them and learn what the scientific and medical literature is saying about them, you'll find comfort in them, I think, and you'll develop a comfort in using them. It'll just take a little bit of time.